My idea in healthcare is to get rid of the chronic disease. That's what we spend $4.3 trillion in healthcare. And 80% of that goes to chronic disease. So everybody, like I said, everybody's idea is are different ways of assigning the cost, but nobody's talking about how do you reduce the cost. What I'm going to do is reduce the cost. I'm going to identify what's causing chronic disease and eliminate those exposures. And then, then we go back to 1960 when we had 6% chronic disease and we were paying 1/20th for our health care that we are today. Those costs, is eliminating chronic disease are going to make those costs drop.
So you don't, you're not a Medicare for all guy?
Well, my choice would be Medicare for all.
Oh, really?
Yeah, but not immediately. I think you need a private
something like Australia?
Well, I don't know, what country I would model after, but I think that Medicare for all ought to be available for people and with public-private options available as well. If you want to go to private insurer for, concierge service or whatever, that you can do that and give people as much freedom as possible. But guarantee health care. But
you would guarantee health care for everybody in America?
Well, my best option would be to do that. I don't think that you can do that all at once, and I can tell you this. That is a battle that I think is polarizing, and that is because the power of the pharmaceutical industry and the power of the medical cartel, that it's just, at this point, it's too much of a heavy lift. So, you're never going to get there. So what I'm going to focus on is things that I can actually do, and not promise people things that I'm not going to be able to do.
What about a public option?
That's what I'm talking about.
Oh, you're talking about that. You could do that. That's what you're saying, but you couldn't.
Well, no, I don't even know if you could get it to a public option at this point with this Congress.
Oh, okay.
But my choice would be, to begin with a public option, and then Medicare. If Medicare for all would take years to work out the kinks to make sure that people like it, that it's popular, that they're doing it right. You need to have a public option during that period anyway. So that's how I do it. I'm not running on that issue. Because what I'm running on are issues that I think every American is going to be able to get behind, and that is going to avoid the polarization. And but if you ask me personally, what I think the fairest way to do it, I don't think what's happening now, where we have this monetized system that is brutal.